Join Lee Bellinger today on the Bellinger Report. Lee is the publisher of Off-Grid Confidential, one of the last information financial newsletters to be delivered 100% through the mail and completely independent of the internet and big tech scolds. Lee has been publishing continuously since 1988 and is your guide to off-grid living.
This is Lee Bellinger with the Bellinger Report, and today I have Dr. Chiang, who has a group called Wealthy Mindset, and she actually talks to physicians about avoiding burnout and other issues that affect their ability to serve patients and all. And so I appreciate you coming on and talking to me today. And so I guess the first step would be to tell us a little bit about the mechanics of what you do and what you offer to people. And go ahead.
Yeah, thank you. I'm so happy to be here. So as a physician, I work for Eyes Ophthalmology in Painesville, Ohio, and I'm an ophthalmologist and oculoplastic surgeon, which means basically I'm an eye doctor and I specialize in surgery of the eyelids. But I also have a life coaching business called Wealthy Mindset, where I help physicians who feel trapped and tied to their paychecks build their path towards financial independence so that they can practice medicine on their own terms. You know, we really have a healthcare crisis coming in our country. By 2030, we're going to have a shortage of medical doctors, and a lot of medical doctors are getting burned out. It's reported to be 40% in the United States of physicians who are burnt out. And a burnt out physician can't give as great of care and is also more likely to leave medicine early.
Absolutely.
So I help working with physicians to work on the mindset to try to overcome the burnout. Obviously, there are a lot of circumstances we can't control, like what's happened with insurance and malpractice and the corporation of medicine. But there is still a lot that we can control. And I do believe that when a physician can be financially independent, they're in a stronger position to make choices in order to be able to practice medicine how they would like to and really have that patient interaction that we were all looking for when we went to medical school.
And as we were discussing before the show came on, doctors have a massive amount of overhead and debt that they're dealing with. And really, a lot of them being scientists aren't necessarily terrific at navigating issues like making enough of a profit and success in their business for the business to be fulfilling to them.
Yeah, it's so true. So medical school, residency, fellowship, none of it teaches anything about money, personal finance, investing, saving for retirement, or even the business of medicine, like having your own practice, what that involves and what you have to take care of. None of that is taught at all during the medical education and training.
That's right. And setting up, and I know a fellow named Dan Kennedy who helps doctors and dentists and professionals like that actually set their businesses up to make them far more profitable by attracting patients and, giving them a higher level of service and all that. And that's very important because people just do feel like a number, and I guess the doctors do as well. With all the insurance insanity and all the compliance people with very little to do but just pick things apart, that's a bit of a problem. Lots of compliance people and not enough productive people. So that certainly is true in medicine. It's just less recognized. It's kind of cool that you're in that field, actually.
Yeah, I spent 2 years working for a big hospital system. And it's certainly, I have spent 3 years in private practice and 2 years in the hospital system. And I really do think that the private practice allows patients to have a lot more access to their doctor, a lot more, you can just call the front office and the front office can go talk to their doctor right away. At that big hospital system, if you call, it's let me patch you through here and go on hold and, okay, I'll send a message. It's a very indirect process and it really provides barriers to care.
Yes, it's not unlike the banks and a lot of other institutions. They've all shielded themselves with voicemail, and it's not a great experience for the customer and the consumer either. So it's great that you're. Tell me what motivated you to come up with Wealthy Mindset. What brought you into that particular field? That's kind of interesting.
So I've always been interested in money. Actually, ever since I was a kid, I was always about making money. And when I was in medical school, I started really learning about personal finance and investing. I started with investing in traditional stocks, bonds, and mutual funds, and then actually got into investing in real estate after reading Rich Dad, Poor Dad. I actually flipped 2 houses when I was a grad student. So I did an MD PhD. So I spent 4 years in grad school. Yeah, and got involved in some other real estate deals. So I am atypical in that I really really financially educated myself very early on. After I got into practice, so I, again, initially started in private practice, and I joined a practice thinking I would buy in and be a partner and learn, the business world of medicine from the person that I joined. When that didn't work out, I decided I wanted to head back home to Cleveland, Ohio. That's actually where I did my med school, my MD, PhD at Case Western Reserve. So I was there for 8 years. And that's where I flipped the houses. And I had, really done a lot of networking with other real estate investors. So I wanted to get back into that real estate investing. And that's when I worked for the big hospital system. Well, working for the big hospital system, especially after being in the world of private practice, I got burnt out. And so I saw coaching for myself, which really transformed my mindset. And after getting the coaching and really, overcoming my burnout, I, decided to go back to private practice as well as start my own coaching business where I could help other physicians and use my unique background in investing, both in stocks, bonds, real estate, but in order to help physicians build their wealth.
That's great. So how long have you been in business doing this?
I registered my LLC earlier this year in 2021.
Nice. And are you getting a good reaction from doctors who are looking to improve their financial management of their enterprise?
So a lot of doctors have really, it's almost learned helplessness, to be honest. Especially I found when I talked to the other doctors working in my hospital, they're like, oh, but I have good retirement here. I just need to, keep going. And really, they don't have that wider outlook. But when you go on Facebook, there are definitely physician groups where people are really looking to figure out how to create wealth and how to really maximize their potential. And so there is, a physician on FIRE, like Facebook group FIRE, being financially independent, retire early. Not that all physicians want to retire early, but like I said before, I think by being financially independent, it's easier to, tell the hospital system, like, I don't need to put up with this, and negotiate from a harder standpoint. So there are now more and more physicians that are looking at investing in real estate or alternative investments and getting that financial education in order to really build their wealth, as well as hopefully a movement for more physicians to, continue on the road to private practice. There's a lot more what's called the direct primary care or concierge medicine as well, where doctors are just providing direct care to patients with a cash pay model as opposed to going through insurance.
Well, it's cheaper than insurance because insurance is dominated by actuarial tables and not a patient's actual needs. It's more of a numbers game. So, with concierge medicine, you can get a lot better access to medical care, in the right way. So that's great. Do you plan on doing anything to help serve the more concierge-oriented doctors? They seem to be a little more savvy about the system and how it doesn't really work for them. How where they actually just say no, hell no to Medicaid and just say you're not worth it. It's not worth it. Do you take that? Do you go that far?
I personally don't practice concierge medicine. I currently work part-time for a physician at Eyes Ophthalmology. Though I do think, especially with the plastic surgery, obviously I can be doing cosmetics, and that is cash pay when I do cosmetic surgery. I also do eyelid surgery that is what's considered functional and covered by insurance. A lot of optometrists, see patients without vision plans or vision insurance, and you just pay out of pocket, and it's really not unaffordable.
No, it's not. That's right. When there's insurance, the bill's always quadruple. So
yeah, unfortunately with surgery, that's when it starts to get potentially unaffordable for some patients.
Yeah. And of course, the international medicine, the travel market for medicine is also interesting, but that's another subject. So let me ask you a question. Can you just go ahead and kind of give us your contact information?
Yeah. So my website for my life coaching is www.wealthymindsetmd.com. Good. I also have a YouTube channel, and it's probably easiest just to go to the website and click on the link for the YouTube channel. I've got a Facebook presence and an Instagram presence.
Very nice. Is there anything I've missed that you would like to say, that you would just like to add? I'm sure I've missed something important. Why don't you tell me if there's anything I've missed you'd like to share with our audience?
So I primarily coach physicians, and I think life coaching, it's a more new and upcoming field. I mean, there have been life coaches obviously for a long time and business coaches for a long time, but I realize a lot of your audience aren't going to be physicians. And so just know that, if there is something in your life that you want to up level or fix, there's probably a life coach that can help you with that.
Very good. Do you have a favorite life coach? Is there some big guru that you modeled yourself after that has a bigger name at this point? Or
so I certified at the Life Coach School, which was founded by Brooke Castillo. So I really follow her teachings. I mean, okay. Tony Robbins is obviously a big one as well in the field.
That's a 101, isn't it? Yep, Tony Robbins. That's right. Okay. Well, is there any other contact information that people could use with you?
You can also email me. It is wealthymindsetcoaching@gmail.com.
Beautiful. Okay. That's great. Well, I appreciate your time today. And I'm sure a lot of people will be interested in the subject. So the doctors are getting their own help with their own wealth planning is actually good for patients. It's going to make them better doctors because they'll be less worried about issues like that.
Yeah, I totally agree.
And I appreciate your time very much today. And,
thank you.
Thanks.